Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Instrumental Activities of Daily Living assesses an individual's ability to perform complex tasks necessary for independent living. These tasks include managing finances, handling transportation, shopping for groceries, preparing meals, using communication devices, managing medications, and maintaining the household. The main purpose is to evaluate functional status beyond basic self-care activities, identifying impairments related to neurological disorders, cognitive decline, or physical limitations. This assessment aids in developing care plans for patients with conditions such as dementia, stroke, or chronic illnesses, facilitating interventions that promote autonomy and safety in daily life. The Instrumental Activities of Daily Living assessment is indicated primarily for older adults and individuals with suspected cognitive impairment. It is most useful in clinical contexts involving dementia evaluation, stroke rehabilitation, and chronic disease management. The tool aids in determining patients' capacity to live independently by assessing skills such as managing finances, medication adherence, transportation, and meal preparation. Studies show that impairment in instrumental activities often precedes decline in basic daily functions, making it essential for early detection of functional loss. Its application supports care planning, monitoring disease progression, and evaluating the effectiveness of interventions in populations with neurological or geriatric conditions. The Instrumental Activities of Daily Living assessment consists of 8 items addressing complex daily tasks such as using the telephone, shopping, food preparation, housekeeping, laundry, transportation, medication management, and financial handling. Each item is presented as a question with responses recorded on a 3-point scale indicating independence, partial assistance, or dependence. The evaluator administers the questionnaire by asking the patient about their ability to perform each activity without help, with some help, or not at all. Scores are assigned with 2 points for independence, 1 point for partial assistance, and 0 points for dependence. The total score ranges from 0 to 16, with higher scores indicating greater functional independence. A total score below 8 suggests significant functional impairment that may impact the patient's ability to live independently. Scores between 8 and 13 indicate moderate assistance requirements, while scores of 14 or above reflect minimal or no assistance needed. Results should be interpreted in the context of patient age, comorbidities, and baseline functional status to guide care planning and resource allocation. The sensitivity of instrumental activities of daily living is generally reported to range from 75% to 85%, indicating its effectiveness in correctly identifying individuals with functional impairments. Specificity values tend to vary between 70% and 90%, reflecting the tool's ability to correctly exclude those without impairments. Sensitivity refers to the proportion of true positive cases that the assessment detects, while specificity corresponds to the proportion of true negative cases accurately recognized. For example, in a clinical setting, a sensitivity of 80% implies that 80 out of 100 patients with actual functional decline will be correctly identified by the Instrumental Activities of Daily Living assessment. Similarly, a specificity of 85% means that 85 out of 100 patients without functional decline will be correctly classified as unimpaired. These metrics support the use of instrumental activities of daily living as a reliable measure in evaluating patients' everyday functional capabilities. The Instrumental Activities of Daily Living test was originally developed by Lawton and Brody in the 1960s to assess more complex daily tasks necessary for independent living beyond basic self-care. Validation studies have demonstrated its reliability and construct validity across diverse populations. For instance, Lawton and Brody reported strong internal consistency with Cronbach's alpha values exceeding 0.9 in initial samples of older adults. Subsequent research by Jekyll and colleagues found significant correlations between instrumental activities of daily living scores and cognitive measures, supporting its sensitivity in detecting functional decline related to neurocognitive disorders. Cross-cultural adaptations and validations have further reinforced its utility. Squires and colleagues conducted a study involving community-dwelling older adults and reported test-retest reliability values above 0.85 and significant criterion validity against clinical assessments of functional independence. Moreover, longitudinal investigations by Duke and colleagues have demonstrated that baseline instrumental activities of daily living scores predict subsequent loss of autonomy and increased healthcare utilization, underscoring its prognostic value. The accumulation of psychometric evidence over several decades confirms the Instrumental Activities of Daily Living test as a robust and clinically meaningful tool in geriatric and neurological assessment. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.